All right.
Take a
Hi,
deep breath.
everyone. Hi, everyone. I am so very excited to be here with my beautiful, beautiful, amazing friend and soul sister, Danielle Wolf. She is someone that I'm excited to share with all of you because I know walking away from this conversation, you're going to take so very much, just as I do every time I have a conversation with her. She
Oh,
is a medium, a medical psychic, author of Four Times a Charm, and hospice nurse. And I really love, her perspective is truly one of a kind because she has experienced great loss herself. She is a medium and she walks, helps others as they prepare to transition to the other side. I hope that each of you walk away with something from this conversation and a different perspective of death and dying here. Danielle, welcome. Thank you so much for being here. I'm really, really excited to have you. I would love to
thank you.
begin by asking you to just share a little bit about yourself and your story, because as we've discussed before, your journey and nursing and mediumship and hospice had started with grief.
Right, it did. So I actually have been a nurse for almost 17 years now. Oh my gosh. And I hadn't really experienced a whole lot of grief in my life up until, oh my gosh, it was 5 years ago now, when I lost my brother tragically in a motorcycle accident. It was very unexpected. Our family was not prepared for it. He was very young. He was 38. And it was kind of a shock to all of us. For me, I primarily worked in the hospital most of my nursing career. So I worked in telemetry and ICU, and that was just kind of where I always wanted to be. And then my brother's accident happened, and he was in the hospital for a couple of days before we withdrew care. And in that experience, I realized that my life wasn't going to be the same again. I started to have a lot of issues working in the ICU, like some PTSD kind of type symptoms. So, for example, I took 2 weeks off of work, which really isn't a whole lot of time. And I had kind of a delayed reaction. I was in just work mode. And what I like to explain to people is that as nurses and healthcare professionals, we're actually trained to work in chaotic situations. But what I didn't realize until I started going to therapy and started my healing journey is that it's also a coping mechanism, and a coping mechanism that isn't necessarily healthy. So one of the nurses in the hospital mentioned to me, because I kept saying, I feel home here. I can't leave my brother. And it's not hitting me. Like, I know that's my brother and I know that's a patient, but I'm not connecting the two. Like it was like a barrier was there. And the nurse said to me, "You put up your nursing shield." And I was like, "What?" And she said, "You put up your nursing shield." She said, "When you go home, it's going to hit you." She's like, "You're in work mode right now." And I thought, "Oh, that's interesting." And sure enough, a couple weeks later, I started having some like complex grief kind of stuff going on. Like all of a sudden, I wasn't able to pour a bowl of cereal for my children. All of a sudden, I would just have these like fits of rage out of nowhere. And then it would turn into like a hysteria where I would just be sobbing uncontrollably. And I was very disjointed, right? Like I couldn't get things together to be able to process. Like it was, and my therapist called it actually complex grief. I was 100% certain that I needed to be institutionalized. I asked my therapist to put me inpatient somewhere. It was a really difficult time. And in the midst of that, I was trying to still go to work. So I took 2 weeks off. My first day back, my very first patient was a motorcycle accident victim who was at the end of his life. He wasn't going to survive and he didn't survive. And it was very traumatic for me to have to encounter his sister, who was also a nurse and making his decisions just as I was for my brother.
Wow.
So I tried to work through that, but the complex grief started really working into my work, and it was everywhere in my life, and I couldn't function. And I started to get this anxiety where I couldn't even talk on the phone. I couldn't leave my house. Like, it was all of these really crazy, weird things happening to me. And so finally, thank God, I had an amazing therapist who said, I'm not putting you on meds. What you need is to process this. You need to go away by yourself somewhere where it's safe, where you don't have to be a mom, where you don't have to be a wife, where you don't have to be a sister making decisions, where you don't have to be the daughter telling your parents that your sibling's going to die, where you don't have to be a nurse, right? Like, you don't have to take care of other people. You can just take care of you for a minute. And if you want to go sit on a log in nature and cry for 2 hours, you can do that. And so that's really the start of my healing journey. And it's making me a little emotional. You can like hear my voice quivering a little bit. I heard this really beautiful quote that said, there's two things in life that absolutely change you. It's love and grief. Mm. And we get to choose whether it changes us for the better or for the worse. And the way that we get to choose that is by consciously choosing coping mechanisms that are conducive to our life, as opposed to coping mechanisms that take us kind of further down the rabbit hole, like substance abuse or whatever that may be, or becoming a workaholic and working so much that you're not feeling things or whatever. So that was really the start of this whole process for me. And so I got to this point where I just realized that I can't work in ICU anymore. Like flashbacks were too much. I would be, doing chest compressions on a patient and I would just start crying. The walls would start closing in. Like, I couldn't handle things the way that I did before. And I had some really good people around me that taught me that it wasn't me failing at life. It was my body's way of showing me that I needed some changes in my life to be able to take the time to process and move through what I needed to do.
Right.
Let's get over my brother's loss, right? Get over the death of my brother. You don't get over it. I mean, like, that's like such a, laissez-faire word to use, I think. You don't get over it. It always is there. But that was kind of what started transitioning my nursing career towards hospice.
But when I want to go back real quick to when your therapist said you need to go away and you need to separate yourself and just be with yourself and not be anything or anyone else to someone else, what did that do for you? Like, how did that help you through? I mean, what was that like?
Okay, so it was really, really interesting, I guess you could say. I'm very, very fortunate that I have a very, very good friend that is a psychiatric nurse practitioner, and my my therapist was like, yes, that's perfect, go see her. And so she lived out kind of in the mountains in Montana, and so I booked a flight and I just went and I just stayed on her couch, and she worked night shifts at the hospital, and I wanted to do like a grief retreat or like a yoga retreat or something to just try to connect spiritually to anything, right? Because I was just in this space where I was so consumed by grief that I couldn't feel anything because everything was so painful. And so I didn't know what I needed to do, but for some reason, Spirit was saying to me, like, you need yoga or something. I don't know. So I went and I hired a woman. I found a lady that was a massage therapist, and she happened to also be a yoga instructor. And so we just worked together privately for 2 weeks. I went to her every day, and she would either do a healing massage, or we would do healing yoga, or processing the trauma through, communication, through essential oils, through like all of these like different Eastern modalities, right, that Western medicine doesn't really utilize, but it's getting better. And after about a week and a half, I started feeling again. She also told me about the book that I was talking to you about, the Grief Recovery Handbook, and she highly recommended that I pull it out. And so I did. I got it and I started working through it. And it's only about 80 pages, but it's like intense stuff. Like it really pulls you back to the very first trauma that you ever had and why you process the way you do. And it unravels all of those things so that you can be aware and then start to incorporate healthy coping mechanisms to get through your bad days.
Wow.
And so that's what I learned during those 2 weeks. And then I also learned in that book that closing the door to the bathroom so that my kids don't see me cry wasn't beneficial for them. And so I learned to bring my family into it. And I don't mean like I didn't displace my grief onto them, but I allowed them to see me go through the grieving process, which I think allowed my children to grieve as well.
Wow.
Gave them that permission.
What a beautiful gift that you gave them there in that moment, to allow yourself to be vulnerable so they could see you, and then they had permission to grieve and to feel their feelings.
Right.
Wow.
Yeah, exactly. So that was what happened with my grief there. And just then that's how we got to know each other. After that, then I kind of started opening up spiritually to mediumship. We were really big into church at first because I think that is like when people are in this grief-stricken state, they're trying to find any kind of higher power or any kind of source to connect to, any kind of spiritual connection to feel like, what's the purpose here? Like, there's got to be a reason, right? Like, why? Like, why would we just come here and experience this horrific pain for nothing? Like, that doesn't make sense, right? So that's kind of what started turning in my head. And so I started seeking God because I thought, well, that's what I need. I need God to help me through this, right? And my pastor used to say, I don't know why things are happening the way that they're happening, but hold on to that fraying rope, because that fraying rope is all you have. And so that's kind of what opened me up to spirituality, honestly. And then it just kind of got to the point that I didn't resonate as much anymore. Going to the actual church didn't resonate. And some of the things about that I would never be able to communicate with my brother again and things like that just didn't sit right with me. And so I don't know, like a little bit later, I started having all of these weird paranormal experiences happen. And I thought I was just losing it. It was after therapy and things were going a little bit better in my life and I was coping better. And my kids' toys would go off in the middle of the night. My alarm clock would go off when it wasn't even plugged in. Like, weird lights were flickering and going out like at exuberant rates where I thought, I need an electrician. Just really crazy things were going on. And then my kids started saying that they were seeing my brother in spirit in our home. And so I don't know why, but I had a girl that I worked with who said, my mom's a medium and you should talk to her. So I connected with her, not very well because she's a really busy lady and in a different state. And so I ended up connecting with a medium that was in my hometown. And she told me stories about my meditations that I literally hadn't told a soul. She told me stories about my family that she couldn't have possibly known. She didn't even know my name. I only talked to her assistant for like 5 seconds via text message to schedule the appointment. So there were all these things. And she said to me, your brother's here and your brother wants to know why you're not delivering the messages that we're trying so hard to give you. And that stopped my world. And that completely changed everything. And that was when I was just convinced, like, there's more to this life than just life and death, right? Like there's more to it, and there's purpose and there's reason. And, I've chosen to not let my brother's death be in vain. And it's hard. It's hard to get to that place. It's not easy. It's painful. It's the most pain that I've ever felt. But now I thank him for contracting with me to go through that experience, because I'm a completely different person, right? Like grief changes you. It changes you entirely.
Right.
And that took me into hospice.
So you went to mediumship, you opened to spirituality, and then you went through mediumship. That's where we met.
Yeah.
And then started to get to see this whole other side, but you had been connected to the spiritual realm prior, like as a younger person,
Oh, yeah.
right? Like you've had this like ability that has been passed down in your family, right? So you were somewhat familiar, but you hadn't experienced. Had you experienced it with someone that you knew prior to your brother?
Yes. Yeah. So mediumship wise, my grandma was a little bit of a wackadoodle, they called her. And she would always, this is my dad's mom, she would always talk about knowing, quoting, knowing when people are going to die. So she would call them warnings. And she said, we're Cajun French. And so there's like some, like voodoo witchcraft kind of fear, because my family's from Louisiana and from New Orleans. And so there was always this fear, but she would talk about it fearfully. And so I think there was some of that kind of weird fear connection to it. And so she would always say, like, I can tell when someone's going to die, but I can't tell who it is. And then we would, as I got a little bit older, her and my dad and I would like kind of collaborate. Like, I'm getting warnings. Are you getting warnings? That's what she would call them. And my dad would say, yeah, I had some, someone kept opening and closing my doors all night. I don't know what was going on. I don't know who it is. And I was the only one that was like trying to figure it out. Like, who is it? And why are they coming to us? And what are we supposed to know?
Right.
So my dad actually had an encounter with a shaman in South Dakota, who they were in a public place, and the shaman actually called my dad over and said to him, totally a stranger, and said to him, you have your gifts because they're preparing to go, and there's something that you need to do to help them prepare. And that's your purpose with that. But he never really tried to go any further with it. Right. And so I just always thought it was kind of a fear-based thing. And I did. My great-grandmother came to me when she was passing away, just before she passed away, to tell me that she was going to. And she did. I actually turned it off when I was 16 because I thought that I killed her. Wow. Right? Like, I had the vision that she was going to die, and then she died. So in my child brain, I thought that I had something to do with it. So I shut it off. I had a couple other visitations from family members over the years. And then the next biggest one I had before mediumship was my grandfather, who is my great-grandmother's son, the one who came to me. And in that dream, they came together and they both told me that he was going to die. And about 3 months later, he did. And so then at that point, I was like, maybe there's something. And you feel things. And I had really good nursing instructors who would say, trust your gut, trust your intuition. So instead of like being like woo and spiritual about it in the medical field, they would say, if you know something's wrong, just call and say, I don't know why I'm feeling this, but my gut is telling me something's wrong. And people will listen to that.
Wow. And that's proved to be true, right? So when you've had those moments, it's proved to be true. And I love that they're at least saying, say it. If you're feeling it, say it. And they're being open to that in the medical field. So then here you are, your family never explored it. You started to explore it a little more after your brother passed away. And so you're exploring it. You got involved in mediumship. You're a phenomenal medium, a phenomenal medical psychic, and you started teaching biology concepts
In mediumship. Yeah.
And which is
Yeah.
a wonderful class. And then
Thank you.
and then now you get, for some reason, you just kept, I remember having conversations with you and you're like, I don't know what it is, but there's something with hospice. And here, you know, I'm telling you, or other medium friends are telling you, it's going to be something with hospice. And
Right.
we somehow knew that this is where it was. And it feels like you're gathering all these tools, you know, to get you here. Right?
Truly, truly. And, you know, I didn't realize this until I actually started hospice nursing, that I was afraid of death. And in the hospital, it's okay to be afraid of death because what we're trying to do is save everybody in the hospital.
Wow.
Right? Like we're aggressively taking measures to save people's lives in the ICU. That's exactly what you do. Right? Like we are, and I used my favorite comic used to be, it was this comic, maybe a meme or something, but it's a drawing of two angels standing on a cloud. And it's like they're talking to each other. And the one says, "I'm sorry I'm late. I had good nurses." And so like that's kind of how I used to like identify with nursing. Like I'm trying to make people stay alive. You know what I mean? Like, and it was like this weird, like kind of egotistical thing. But then after I went through all of this grief, I realized it's because I'm afraid of death. That's why.
That is a normal thing. Most people are severely afraid of death.
Right. And I've learned through hospice that you don't have to be afraid. And I've learned through hospice that the dying process and death is just as important as the birthing process. And it can be just as beautiful and just as meaningful as birth.
So can you explain that? What do you mean by that?
Yeah, I can. So the first thing is like, you know, we were talking about like, what are we going to talk about in this interview and what are we going to kind of approach? And we're talking about grief, right? But it is painful, right? Like our species, the human race, is not well equipped to handle loss, right? Like other species don't tend to have that higher cognitive level of thinking where they can really like get into it. They just kind of, they get their loss and they move on, right? Our species is totally different. We do not handle loss well. And also this may be a little conspiracy theory, but we're always afraid of being injured or being killed, right? So I feel like there's a control factor there too. Like people want to harm us or they want to hurt us, and that's what we're afraid of. And that's usually what pushes us to be good or do good or not get in trouble or not encounter bad people, et cetera, et cetera. Yeah. But, you know, like my thought process is now is like, my question is, why are we so afraid? It's because of the unknown. We don't know what's going to happen and we're afraid it's going to hurt, right? Does that stop us from giving birth? No. Like birth hurts, giving birth hurts, coming into this world hurts. It hurts you as the baby. It doesn't feel good on your head, right? It hurts the mom. It doesn't feel good. But we don't stop it, right? Like we don't say like, we're not doing that anymore. We're too afraid of the pain that it's going to cause. So we're not going to do it. And we're not going to talk about it. And we're not going to address it. We actually now on the birthing side have birth plans and we talk about it and we have birthing coaches and we have doulas and we prepare and we have classes and we have all of this preparation to have a baby. Why don't we have that preparation at the end of life? And now I'm not just talking trauma because trauma is different, right? Like when you have a sudden traumatic loss, that's a little bit of a different situation. But I'm talking end of life, body shutting down, going through the natural passing process. I feel like it's not talked about enough. And I feel like the more we can talk about it and bring light to the things that I've seen and the things that other nurses have seen, it can make us less afraid. Because now that I've been doing hospice for a while, I'm not afraid of it anymore. actually, I mean, I'm not saying like, let's go out and, harm ourselves or let's,
Right.
throw in the towel early. I'm not saying that.
Right.
I'm saying like, let's live our lives to the fullest while we're here, but we can plan, right? And we can have those difficult discussions with our family members.
Yeah.
Now, because the truth of the matter is, I've asked patients that are actively dying that are still able to communicate, do you know that you're dying right now? And they say, yes, the majority of the time. It's like, and I see a lot of families that say that we're just not going to talk about it. We're not going to talk about it. We're not going to tell mom about it. We're not going to dwell on it. We're not going to have these conversations. But could you imagine doing that preparing for birth?
No.
No.
You go in with the plan, even though the plan doesn't always happen, I mean,
Right.
majority of the time it doesn't.
Exactly.
But the conversations are happening. You're reading about it. You're learning about it. You're preparing with your loved ones.
Yes. And so if you can have these conversations with your loved ones now and say, hey, like it's really difficult to address your mortality, right? And to acknowledge your mortality and to acknowledge the fact that we're not going to be here forever. It's really difficult. But the more that I read, the more that I see, the more that I experience, the more that I realize we're really not, we don't go anywhere. Energy doesn't die. It's been scientifically proven that energy lives. And we are breathing the air that Joan of Arc had breathed, like the energy doesn't go. It's proven. We just have to acknowledge and accept a different form. Our vessel has given, our vessel's no longer able to carry us.
So what conversations should we have? I wouldn't know where to start with that.
Yes. Okay, so beautiful question. Beautiful, beautiful question. Okay, so how do you want this to go? Right? Like think about it like with your birthing process. When you find out you're pregnant, you think to yourself, how do I want this to go? Same kind of situation. How do I want my dying process to go if I have the opportunity to have a say in it? And people that die naturally do, and especially if they're on hospice, they have the opportunity to kind of formulate a plan. And that's my purpose and my intention of being your nurse, is to start to build the bond and the relationship so that you will feel comfortable to talk to me about it, right? And my job is to open up some of those lines of communication, which isn't always easy, say like, hey, let's have a talk. Do you mind if we discuss this? And I've had patients say, nope, I don't want to talk about it. Okay, because everybody processes differently at different rates. But to be able to say like, do you want to be medicated or no? Because I've had patients that are like, knock me the F out. Like, I don't want to feel anything. I want to be totally comatose and just go easy, right? Just like some people say, I want my C-section. I want my spinal block and I want my C-section so I don't feel it, right?
Yeah.
I have had other patients that say, I want to know what's happening. I want to try to be aware cognitively, and I don't want any medications to cloud that.
Wow.
Just like we have people that say, I want to have natural childbirth.
Right.
Right. And there are times that patients say, I don't want any drugs. And they just like with labor, and then they get to it and they get to the labor intensive part of work, which is the same with the dying process. Wow. It's labor intensive. It's a laborious process for the soul to leave the body. And sometimes they need medication to relax the body enough so that they can expel the soul, just like you expel the baby, right?
Yes. So do you ever have people who are holding on and not wanting to?
Absolutely. Absolutely. Yeah. And I actually, like, you and I have talked about this specifically. I had a patient who was, he had a slow cancer, and it just ravaged him over several years. So he had a lot of time in bed by himself to process and have these in-depth conversations with himself, right? And with us, with his healthcare team, which was really nice, because he was so open about the conversations. And he was the one that was like, I just want medication for the pain, but I still want to be with it. I want to be alert enough to know what's happening so I can come back and tell you. That's what he said. But when it came down to it, so what he said was, this is where I was going with it. So what he said was, he was like, there's this fight that happens, right? Like you and I have talked about it. There's this struggle, this fight that happens between the soul and the physical body, where the physical body maybe can accept it, or the soul has maybe like accepted and says like, okay, I'm ready. Like, we're going to be good to go. Like, I've accepted it. I'm not afraid. Whenever it comes, I'm ready for it.
Yeah.
And then there's the physical body who says, my purpose in life is to keep you alive and to procreate, right? Like, so the body starts fighting subconsciously, like without conscious effort, the body starts to rev up, and the body starts to try like to take as much it's like its last big fight to keep you alive, right? Because that's the body's purpose, is to keep you alive. And it's so good at that.
Yeah.
So sometimes you need some of that calming medication to control the fight that you can't, it's like when you have your adrenaline rush, you're not consciously deciding, right? Like that's your amygdala making that decision.
Right.
And it's the same thing there, right? Like,
that makes sense. That makes a lot of sense, and a really good way to think about it and put it so someone like me could get it, because I don't usually get it unless you give those examples. So it's really great. So I want to go back though. So the questions we should ask prior, or how we should be preparing, is, do you want to be medicated, right? How do you want this to go? That's
like the typical questions that we ask in the hospital are like the 5 rights. Like, do you want to be intubated if something happens and you can't make that decision and you can't breathe on your own? Do you want to be intubated? Do you want to be on a ventilator, or life support, right? Do you want specific medications? Do you want enteral feedings? Do you want IV hydration? Like, so those are the questions that you would ask like in the hospital setting, right? So those are like traumatic events. So you definitely need to have those conversations, and you definitely need to have a living will. And I'm willing to guess that most of the people watching this interview have experienced a significant amount of grief.
Yeah.
Usually precipitates us making a plan and getting a living will, right? Because we see how other people react, or, like, I saw how my dad took care of my brother's estate and it was awful. And I was like, nope, like I got to get my stuff figured out.
Yeah.
So those are the type of questions that you should be asking for like traumatic events. Absolutely. You should also ask those, but like once you kind of transition and it's like, okay, I'm 60 years old, or I'm 40 years old and I have cancer, or I have COPD, or I have some kind of disease process that's now taking over, and my body isn't able to fight it the same way that it needs to sustain life, right? So my life is starting to go, right? But maybe not active yet. In those situations, you need to have those same conversations, but you need to have the conversations of, okay, so when it's your time and you transition into the active phase, which is very much, again, like that birthing process we were talking about, there's phases and transitions with natural death that occur with natural birth, right? Like you can kind of see it coming, and you can see the phases, and you can kind of, you see the process unfolding just like you do with labor, with childbirth. So do you want to be medicated? If so, do you want to be totally knocked out? Do you want to be awake enough to know what's going on? Do you, do you want us to change your dressings every day? Like you tell me how you want me to care for you.
So that's what you ask as the hospice nurse, right?
Yeah, I do.
Yeah. As a family, though, what should we be asking? If we have a family member who's sick, or if we are sick, what conversation should we be having with them?
Those exact same conversations. Okay. Like, hey, I see that we're kind of headed down this path. Is there anything specific that you'd like? Is there anybody that you'd like in the room? Is there anybody that you wouldn't like in the room? You know, is there anything that you're afraid of? Right? Because we're all pretty much afraid of something, and that's usually why it's that fight and that struggle, right? Like if nobody was afraid of death, we would all just lay down and be like, all right, cool. You know, like let's do it. But there's this fear, right? So you have to talk through the fear, and you have to get to the root of it. Like, what are you afraid of? I'm afraid it's going to hurt. Okay, well, here are some things that we can do to prevent the pain, right? Like, it is a process, and there is coaching that should be involved in that. And to have those conversations with your loved ones before they transition to actively dying is really a beautiful thing, because then you can know with certainty, okay, this is what they want, and I'm going to try my best to fulfill those obligations. Or if there's a healthcare provider coming in, then you can advocate for your loved one, right? And say, no, that's not what they want. This is what they want. And then you can kind of collaborate and plan together and, you know, formulate that plan of care.
Ah, beautiful. Thank you. Yes. I mean, I do want to ask you this. What would you like other people to know about death and the dying process here? You know, so a lot of people watching this may have, I mean, they've experienced grief themselves. We all have, like a passing
Right.
of a loved one here.
Yeah.
What would you like seeing this, being so much around it and helping people walk through this, and then also being able to connect to the other side afterwards,
Yeah.
you know, having all of that and experience grief yourself? Like, what would you like people to know about hospice, about the dying process?
Yeah. So the first thing, what I'd like people to know about hospice is that I feel like in the public, it has kind of a negative connotation. Like we're just giving up on you and we're not going to take care of you anymore. And we're just going to fill you full of morphine and just let you die in your bed. Yeah. I hear that a lot, and that's not the case a lot. The actual truth of the matter is that studies have shown that patients that have the same disease process with the same progression typically live longer on hospice than they do without hospice. And that's because of the supportive effort that they have, the supportive care. So they're being taken care of more, they're being watched more. The doctor's office is coming to your house. You're not going to the doctor's office. You know what I mean? And so I feel like hospice is becoming a really beautiful thing, a beautiful tool that can be utilized and should be utilized before somebody's actively dying. Because we do get those patients where all of a sudden they just go bad and they're on hospice and they die within 2 or 3 days or a week, where we don't really get to know the family. We don't really get to educate them about what the dying process looks like and things to look out for and pay attention to. And it's really about educating you and supporting you and loving you and your loved one through that experience. That I'd like to know. The other thing about death, I don't like to say I know what happens when we die, because I've not died. So all I can do is just give you my experience and my speculations, right? And my opinion. What I can tell you is that I've seen enough to know that something really beautiful happens most of the time. That we don't just die and dead, we're gone, that's it, no more. I've had so many patients that their loved ones come back and help them cross over. You know, like I see my dad at the end of the bed. Oh, my grandma's over there sitting in the chair. Oh, my aunt's right there. Oh, my son is here. And that we don't have to cross the bridge by ourselves, right? Like me as a hospice nurse and your family, we're here to walk you to the bridge, right? And then we hand over the reins to your loved ones on the other side, and they walk you the rest of the way. Right. It's beautiful. Death can be a really beautiful experience, and there are some cultures that actually celebrate death and they don't celebrate birth. And the reason why is because they believe that death is a reunion. It's a homecoming. You're getting off the roller coaster ride, right? Like you're getting home from your internship, you're coming home from college. Yeah. So that's what they celebrate. And they say, how can we celebrate somebody leaving home when they're born? So, I mean, I like to celebrate all of it, to be honest with you. But it's just a different outlook, right? Like it's just a different experience. And through the grief, there's an immense amount of learning that can occur and that does occur for all of us. It changes us, it grows us. So I think the biggest thing that I want everyone to know is like, it's not the end.
Not the end.
It's not the end.
At the end. And I love that you compare it to the birthing process and that that celebration connected to it. We celebrate those lives coming in with the birth. And then as they leave, we mourn, but then their loved ones or the other side, they're celebrating them and they're walking them over that bridge. And in every reading, there's usually someone that they validate that was with them to walk them
Yes,
home, that was there
exactly.
to help them cross over. And it's so beautiful that you've been able to see that in more than one patient and
Oh,
have them
yeah.
validate that. And a lot of people push it off as, a lot of family members might be like, oh, they just weren't well at that time. But it's not
Right.
true, because there's no way as the medium we'd be able to know that, but they bring it up all the time. Their son really was there waiting for him,
Yeah.
walking him home,
Yeah.
it's just so beautiful. Thank you so much for this conversation.
Thank
Ooh,
you.
that was just so powerful. I could listen to you all day. I could listen to
I
you
love
all
you so
day.
much. Thank you for listening to my
Oh,
babbling.
no, I know that there's going to be so many people that are changed listening to you and now can have a different perspective. It's just such a gift. You're such a gift. I am really excited to be giving away your book as one of the giveaway books. So
Yay.
for those of you who don't know, I'm going to go a little bit into Danielle's book, Fourth Time's a Charm. It is a phenomenal book. It's about, with Fourth Time's a Charm, it's because you've been married 4 times. And I love
Yeah.
that you take this, something that maybe someone might not share with the world. You take this and you're like, hey, look at all these lessons I've learned, and it's gotten me to where I am. And this book, I believe, is for every single person. It is not just for those who are married. It is to help you with your relationship with yourself so that it bleeds into the relationships in your life here.
Yes.
Friendships, coworker, you can, whether you are, family relationships, like you can go, there's a lot of questions in here, like a little workbook questions that you can work through on your own. And if you don't have a significant other, you can do this with yourself, answer these questions for yourself, or another relationship that you're working on in your life that maybe you've had a hard time with. This book I've read a few times, and I'm really excited to share and to give away to a couple of the followers, because it is just a self-transformational book. It reminds me of our conversations, like the conversation we had here, but like, where I just feel like I'm talking to a girlfriend, or a girlfriend's giving me really great advice about their experience and how, what they've learned. And really, you're the best person to give it marriage advice, but also it's a lot of like, self-help. That's what it is. It's like you help yourself so that it bleeds into your marriage or to your family life or whatever it may be. So I'm excited to share this, and I'm hoping that this book also, that this conversation helps people walk through
I hope so too.
grief at this time, but then also this book kind of helps them walk through, or gives them a new tool to give to themselves. So
absolutely.
Yeah. So thank you so much, Danielle.
Thank you. I love you so much. I think this is such a beautiful thing that you're doing. So I love you.
I love you. All right. Bye-bye.